The Legacy of Wisdom Project gathers and publishes answers to many of humanity's most pressing questions from some of our most experienced and profound leaders. One of the big questions is how we can collaborate with the medical community in terms of our own health care. So much is being dictated about what we can use and what we can't use. How do I make an intelligent choice about health care?
You see me smiling, and the reason I'm smiling is because one of the things that people constantly want to do is to get somebody else to do things for them. And I'm not saying I'm not like that either, because I am. But I think one thing that I've learned in my research on aging and health is that prevention works. All of the things, and the thing is, everybody knows what they need to do to up the odds that they're going to be healthy. And they don't do it. So, it's not a matter of having the healthcare system be, we can talk about what would be better with regard to the health system, but the truth is that the number one thing that's causing people to not be healthy is them. I'm not trying to minimize the fact that people have hereditary diseases and people have accidents and all kinds of bad things happen, and some people have bad heredity about that and so forth. But the truth is that if you wear your seatbelts, if you don't smoke, if you watch your weight, if you don't eat too much fat, if you take your statins, if you take your blood pressure meds, if you do the things that you're responsible for, and you do those kind of regularly, you have much better chance of having a good health outcome, all things being equal. And so and the books are full of those steps that people could take. They just don't do it. So people get in 12-step programs to help them get rid of their bad habits and develop better habits. They do there's all kinds of things that people can do and do. But when I was doing I did a longitudinal study where I started when these people were all age 50 or older in July of 1975. And I followed those people for 20 years. And the people who did the preventive health things constantly over that period of time had vastly better health outcomes than the people who didn't. And they were all over the place in terms of what kind of health insurance they had, what kind of income they had, what kind of, all of that. So it really comes down to individual motivation and commitment to be healthy. Now, can you make it happen? No. Can you improve the odds that it will happen positively for you? Absolutely.
Okay, and what about concepts that tend to promote our own taking care of ourselves rather than running to the doctor with every bobo that we have?
Yeah.
There are concepts like the inner doctor, for instance. How do you feel about these?
I think one of the things that is really difficult nowadays is that most people, I think, don't have very good background for evaluating what they would read if they were trying to look up and read about and get some sense of what their landscape looks like. So I think that's a real issue. The issue there is actually lousy science education. And so as a society, we basically subsist poorly on a diet of what I call PR science. The latest single study from the New England Journal of Medicine is taken as advice on how to lead your life by people who don't realize that in order to know what to do about that particular thing, you need 20 studies. You don't need one. And, it's just that problem of news media being so hungry for information, they'll put out just about anything. And users having such short memories, apparently, that they just believe the most recent thing, and they forget about the things they've heard down in the past and so forth. I mean, it's really scary from my perspective. I watch people in my family do this. I mean, I have a daughter-in-law who basically says, I don't believe any of it anymore because I don't think anybody knows what they're talking about. And that's where we've come with our science education about health. We've gotten people to the point where they don't think anybody knows anything, therefore they're hopeless with regard to doing anything about their own health. Now, what kind of situation is that? It's certainly not an awake, aware situation.
Any way to improve that?
Well, again, I think it goes back to institutions produce what consumers demand. And unfortunately, we have a lot of sheep in our society that are essentially just going down whatever chute people point them toward. And they don't really want to pay attention. They just want to chew and walk. They don't really want to have to decide anything. They don't want to have to do any work. They don't want to have to go to the library and dig around and find out what they need to know, etc. They don't want to have to go through the agony and work that's involved in creating a network of people who do know something about it, whatever it may be. And one of the great things about the online communities, actually, is that there are all of these support groups for people with various kinds of illnesses, diseases, challenges, this, that, and the other thing. And a lot of these groups are actually full of really smart people who know a lot more than the average person does about it, so they can be very helpful. But again, when I used to teach research methods, I would go into class and I'd say, okay, today we're going to start working on your baloney detector. Because one of the big things as a researcher is you want to be able to separate out the good stuff from the stuff that's tangential, irrelevant, wrong, whatever. And so research methods are designed to give you the techniques that will allow you to do that. But people aren't learning to do that anymore in school. And, I think that's a big thing. And I blame, to some extent, the whole postmodern idea for that, in the sense that can you ever have faith in absolute truth? Probably not, because everything's going to change. But can you have a really well-informed idea of what's true? Yes, you can. And just because nothing is absolutely true is no excuse for people not becoming as educated as they can be on a subject, and to being skeptical about whatever baloney is being shoveled their way. I mean, we have tons of it being shoveled on a daily basis here, and people are very unprepared to be able to tell which is which. So it's interesting, though, as incensed as I am about this, I am never hopeless, because I believe that underneath all of the hoopla about what our society does in its various institutions, and I don't think they're serving us especially well right now, but they're serving us adequately in most cases, and I think that a really large majority of people are figuring out how to cope with whatever kind of life they have, and to have fun sometimes, and to, even though they're going to get foreclosed on, they aren't, jumping off of a bridge. So, it's just, the human spirit is a lot stronger than most people give it credit for, I think.